Hi, I'm Dr. Steve Daniel with Norton Sound Health Corporation. November is Diabetes Awareness Month. Awareness is a really important idea. When we head out to enjoy the tundra, mountains, and sky, we learn to be aware not only of the amazing beauty, but also aware of possible signs of trouble. It's a blessing to enjoy the seasons and nature, and it's wisdom to stay aware of risks like bears and sudden changes in weather. It's this same kind of wisdom that diabetes awareness is all about. Enjoy the blessings of full and joyful living and be aware of the risks to your health, like diabetes. What is diabetes? Well, a healthy body takes a lot of energy, which means turning food into fuel. That fuel has to travel out of the blood into every single one of our over 30 trillion living cells that make up our muscles, bones, heart, brain, all of our organs. Diabetes is a chronic or ongoing disease that causes problems with getting the body's main fuel, a sugary energy called glucose, moved out of the blood into the body cells for energy. In diabetes, glucose fuel is trapped in the blood and it stays floating around there, causing what we call high blood sugar. While the body cells are starving and screaming for glucose, all the energy they need is literally just outside their doors, trapped in the blood. What effects does diabetes have on people? Well, after a while, all that high blood sugar starts seeping into places it was never meant to be, like the back of the eyes, the kidneys, and nerves, where it causes inflammation and then permanent damage. Diabetes doesn't cause that damage right away. It has a way of sneaking up on people. And when it goes unchecked, it begins to make them feel, well, lousy. Symptoms of high blood sugar include feeling tired all the time, urinating frequently, a nearly unquenchable thirst, blurry vision, rapid and unexplained weight loss, which is not healthy, and yeast infections. Over time, high blood sugar can lead to an increased risk of heart attacks, strokes, damage to the kidneys, eyes, and nerves, immune system problems, and foot infections leading to amputations. Once the damage occurs, it's usually permanent, but these problems can often be prevented if diabetes is diagnosed early and steps are taken to manage it. Who gets diabetes? How does it occur? There are different types and causes of diabetes. It isn't always the same for everyone. Diabetes sometimes occurs for the first time during pregnancy, so early and regular prenatal care, which includes testing, is really important for keeping mom and baby healthy. There are also immune and genetic causes, but for most adults, diabetes begins when we become less active, something that's easy to do with lots of time sitting in front of a TV or other screens, busy schedules, aches and pains, depression, and challenging weather with long winters. Risk increases with eating processed and fast foods, unhealthy snacking, drinking sodas and juice, eating in front of the TV, and eating sugary foods every day instead of making them a once in a while special treat. All this can gradually increase weight, which becomes difficult to lose. Of course, there are other factors like stress and problems having access to nutritious foods. Who needs to get tested for diabetes? About 10% of Alaskans have diabetes, but a fourth of those people haven't been diagnosed yet. Diabetes is affecting the health of thousands of adult Alaskans who don't even know it yet. The American Diabetes Association recommendations include testing for diabetes in everyone whose weight is more than what is recommended and has at least one other risk factor, such as being Native Alaskan, high blood pressure, high cholesterol, a family history of diabetes, or being less active than is recommended. It's also recommended to get tested in anyone who's had a pregnancy with diabetes, and it's also recommended that all adults age 45 and older get tested. After an initial screening test, if it's normal, these people need to get tested again every 3 years. What's the take-home message? Well, good health is not only about living more years, it's also about improving the quality of those years. We all have people and activities that are important to us, and that's part of good health. Be aware of diabetes, aware of your risk factors, aware of the symptoms, aware of who needs to be tested, aware that diabetes can sometimes be prevented and can be managed successfully, but ignoring it can have big effects on how well a person feels and their quality of life. And be aware there is a team of caring and trained people at Norton Sound Health Corporation who are ready to help you and your loved ones through every step of diabetes care. To learn more, call the NSHC Camp Department at 443-3365 or talk to your healthcare provider. Thank you.